We really appreciate all your support. We could not do this without you and all our clients and all the citizens of Indiana. So we can't say thank you enough for what you've done for us. We're all super excited in Large Animal about the new facility. There's so many things that I could tell you about. I'm going to try to keep it to a few. I guess overall, the nicest thing is the separation of species. If any of you have been here before, you could come into the large animal clinic and run into a goat, a pig, a cow, and a horse. Well, now we've got separate facilities for equine and for farm animals. So I think the separation of species will help us with biosecurity, and it'll help us to be better serving of our clients in terms of, we can concentrate on their species that they're bringing to us. So the separation is going to be, I think, really a big improvement. I'm going to start out a little bit with the farm animal facility. Dean Reed showed the ability to drive through the building to drop off animals. That's a tremendous improvement over what we have now in terms of getting cattle moved safely through the facility. So the ability to drive through, and we can actually handle a large herd of animals and get them unloaded and moved where we need to work on them. So that will certainly help the safety for us. I mean, we have students from all over, a lot of backgrounds. Some of them don't have farm animal experience. And so the ability to have the ability to safely move animals around is going to be a big improvement. We're also, for the first time, have ability to weigh our farm animals safely. Oftentimes, they're not tame enough to walk to a scale. So actually, we don't have to estimate body weights. We'll have the ability to get a scale so we can do accurate drug calculations. So the equine in the large animal, the equine hospital, there's numerous things that are going to be improved. I mean, the increased number of treatment rooms. We share our treatment facilities with ophthalmology and all kinds of different internal medicine and surgery. So we have more treatment rooms to better serve all those different areas. So that will be a big improvement. In terms of the layout of the hospital, it's going to greatly improve the way we can move things around. The surgery area, for example, will be closer to diagnostic imaging. Dr. Fulkerson highlighted some of the things about diagnostic imaging. We're very excited about the possibility of doing standing CTs in horses, which is something that currently we do under general anesthesia, but the new facility has an outlay to actually facilitate a standing CT, which will really help us, especially with things involving the head. The surgery rooms are laid out a lot better. Dr. Weil mentioned the safety with recovery stalls and induction areas. There's also dedicated surgery areas for standing surgery, orthopedic surgery, and soft tissue. So that will greatly improve our ability to provide better patient care. We also have the equine outpatient facility, which we're doing more and more procedures and lameness examinations. So the equine outpatient area will help us actually with biosecurity as well, because we can keep those outpatients in a certain part of the hospital. And then finally, we also have improved diagnostic capabilities for lameness. He showed the covered pavilion round pen that will help. We'll also have some different footing surfaces to examine lame horses, and we'll have special footing in the breezeway to do lameness examinations in the wintertime. So in general, there's lots of things that are, the last but not least, certainly, is we have improved instructional spaces for students and for rounds. There'll be more dedicated rounds rooms. We're always at a premium for instructional areas, and the new hospital accounts for greater instructional space for students.